President Obama is calling on other nations to step up their fight against Ebola, but he says the chances of an epidemic here are, quote, extremely low.
We are familiar with the protocols that are needed to isolate and greatly reduce the risks of anybody catching this disease, but it requires us to follow those protocols strictly, and that's exactly what we are in the process of doing.
Chief Medical Correspondent Dr. Jon LaPook is here. Good morning.
Good morning, Charlie.
How worrisome is it that healthcare workers in a Western country contact Ebola?
Well, certainly nobody's happy about it, and you heard President Obama talk about the difference between having a protocol and following the protocol. And I think that's what people are going to be looking at very closely. There was a picture of the priest who died of Ebola being brought in, completely geared up. Everything looked like it was protocol. That's the picture you saw, and I'm sure what people really want to see are the scenes that were not photographed. Was there some kind of break in protocol?
But the World Health Organization says that infections among healthcare workers are an alarming feature of this outbreak. How could that be, since health workers know how this virus is contracted?
Yeah, but a lot of times obviously most of it is in West Africa, and from what I've been reading and talking to people who've come back is that one of the problems initially was you had the Ebola wards and then you had the regular hospitals, and often there were people in the regular hospitals who they didn't suspect had Ebola, who ended up having it, and they were in contact with them. Also, we don't know about the protocols there. The equipment isn't necessarily perfect, so it's not super surprising.
I know you tell us to not fill up our worry bucket, as you told us yesterday, but now another case in Spain. The President of the United States talking about additional screening procedures at airports here in the U.S. and abroad. Charlie had a great question, which is,
what's the worst case scenario?
Yeah.
In other words, we understand we don't want panic. We understand we're doing everything we can. But what if things go wrong? What's the worst case?
You journalists always ask about the worst case scenario. You could walk outside.
Shouldn't we know what could go wrong?
Yeah.
You know, everything could go wrong, right? But it's a matter of percentages, seriously. Yeah. I mean, you could walk outside and look up at the sky and it could say, freedom's just another word for nothing left to lose. What are the odds of that happening? Really close to zero. So if you start worrying about these tiny percentage things...
We're not talking about worry, we're talking about being aware.
Well, okay, so the worst thing that could possibly happen is that it gets out of control in the United States, but... again, as I said yesterday...
Or in a country like Spain.
Yeah. Or any... yes, I'm just saying, it's already out of control in Africa, okay? And you worry about it coming to other countries, and I think, yes, that's the worst case scenario if you're really asking that. Okay. But I do not think it is at all likely, and neither does any expert, because we do know how to control. We know how to stop it in its tracks.
And all of you healthcare officials are communicating that very clearly.
Yes, we have to learn how to do these protocols better.
Thank you, Jon.